Today's One Health Connect series revolves around a subject that is one of the most pressing public health challenges of our time. Leading the cure. How modern medicine must drive India's war on obesity.
The metabolic health begins much before the pregnancy. It starts in the womb actually. So even when the child is before born, what exactly is happening in the pregnancy that we should be worried about or be hopeful about?
The first 1,000 days means starting from the day of conception up to the second birthday of the child. These 1,000 days are very, very crucial because during pregnancy, along with the growth and development of the baby's organs, the baby's metabolism is being programmed, the fat storage, the appetite regulation, everything is being programmed inside the womb itself. So patients who have uncontrolled, neglected, undiagnosed gestational diabetes, they expose kids to a very unhealthy metabolic environment. And as a result, the baby comes out carrying a risk of increased insulin resistance and risk of development of diabetes in the future life.
How important is breastfeeding when we are trying to shape up the metabolic health of the child?
Breast milk is the best for the baby, and it's going to give the immunity enhancement of the baby, mental IQ level, cognitive factors, this all going on the higher side. What's the best advantage for the breastfeeding to the mother? So we are all talking about so many cancers nowadays. So breastfeeding is one of the factors which is going to protect the mother from the breast tumors, from the cervical cancers and all kind of things. The mothers who are not doing the breastfeeding in some other condition, that's not only factor which is pushing the babies to be obese. There are certain other factors as genetic and all.
Do you feel as India, the health programs that we already invest in at a government level, at a public-private level, are they good enough or we are late for this kind of prevention?
Where we go together, in schools where we go together, is the seeds of enlargement of the waist circumference, overweight, obesity, fatty liver. They probably started prior to conception. All you need is 200 grams of fat as an adult, as ectopic fat on your liver to qualify for fatty liver disease. So you can imagine, and the biggest storm, the metabolic changes that happen in a woman is during pregnancy.
Obesity conjures up in the minds of a common man is diet, lifestyle choices, exercise. At what point does it cross over to the other side where it becomes a critical condition that needs to be addressed surgically?
Bariatric surgery becomes a option only when the patient is not able to perform his routine duties. This is very basic. Okay. According to the scientific definition of morbid obesity, if someone has BMI in the Asia Pacific region, including India, is more than 32.5, then he is a candidate for bariatric surgery. Even obese patient obesity patient who are more than 27.5 with metabolic syndromes, conditions like hypertension, diabetes, dyslipidemia, obstructive sleep apnea, even MALSD and fatty liver disease and so many problems, then they are the right candidate for the bariatric surgery in the Indian scenario.
How would you place laparoscopic and minimal access surgery in terms of patient safety, hospital stay, recovery and long-term outcomes? How would you place it?
So minimally invasive surgical techniques have primarily performed through laparoscopy, have transformed obesity management by making bariatric surgery safer, reducing recovery time, improving long-term health outcomes. These advances have helped bariatric surgery become a standard treatment for severe obesity rather than a last resort procedure. First point is improved safety. Second point is faster recovery. So modern minimally invasive bariatric procedures produce substantial and durable weight reduction.
Obesity and its relationship with chronic pain and joint disorders. Do you think if we deal with obesity properly, you would have less of hip and knee replacements?
We have this vicious cycle that we see, wherein you say which came first. Did the obesity come first, and therefore I have pain in my knees, or I have pain in my knees, now I can't walk? We can now say that we know that obesity did come first. Obesity is such an important factor for osteoarthritis. It doesn't have one-to-one coincidence.
Obesity is a complex metabolic disorder affecting multiple body systems involved with the maintenance of balance. An often overlooked consequence of obesity is the severely impaired balance and poor postural stability. It induces more falls, vestibular disorder, plus the obesity is making you much more unstable and making you much more prone to falls. Obesity is not just a musculoskeletal or a cardiovascular issue. It is a profound neurological and a vestibular threat. Weight management is not a cosmetic goal. It's a critical neurological preservation strategy. So you have to take it in that perspective.